Hello, this is Khabir Southwick, traditional naturopath, Ayurvedic practitioner, and herbalist in beautiful Ojai, California. This talk is going to be about understanding the different types of pain, or shula, according to Ayurveda. So, according to Ayurvedic ancient text on clinical practice, a shula, or pain, is treated as a separate disease, or roga. However, many times we experience pain as a symptom of another disease. The difference between a symptom and a disease is that a disease has a clear pathology, specific signs and symptoms, and it undergoes a process where there are certain doshic changes. On the other hand, a symptom isn't necessarily due to one particular disease process. A symptom can be caused simply when a dosha accumulates in its own site without producing a particular disease. When symptoms are incompletely manifest, they're called purva rupa in Ayurveda, which means warning symptoms. And when signs and symptoms are completely manifest, they're called rupa. When pain is constant and persistent and is a major problem, then at that point it can be considered a disease. So we're going to talk about understanding the three major types of pain, shula, according to Ayurvedic text. And this is very important to understand because if you have pain or inflammation in your body, whether it's in the joints or in the muscle or in the nerves, then the first step is to understand the type or the doshic imbalance behind it. This would either be a vata type of pain, or a pitta type of pain, which is blocking vata, or a kapha type of pain, which is also blocking vata. And once you know of this type, then you're able to determine the type of food, the type of dietary regime, type of lifestyle, and of course herbal treatments to address your type of pain. And this is why people are very confused about using analgesic herbs or pain relieving herbs. It's because different ones have different actions and will be suitable for different types of pain. Same goes for a diet. Some pain is hot and inflammatory and feels better with cold foods and cooling foods and cool treatments like ice pack. And other pain is hot and inflammatory. The other type of pain is dry and cold and rigid and rough, and it feels better with moist, hot, and warm, like a salt bath. And other types of pain are swelling type of pain that feel better with movement, for example. So we're going to understand these three major types. Of course, there are other causes to pain, including excess toxicity, and many diseases, pain can be as a symptom, which I mentioned earlier. But we're going to first just try to classify our type of pain so then we can understand what types of treatments and dietary approach will work best for your type. The first type is the vata type of pain. And since the vata dosha is primarily responsible for pain because it's so closely related to prana, which really governs the nervous system and all sensation. As we know, the vata's main seat or home is in the colon, and from there vata moves into the other bodily channels. It flows throughout the body and the organs in this manner. So when the prana becomes disturbed due to imbalance or one or more of the qualities of the vata dosha, the result is that there's either pain in the body or in the mind even. We know the qualities of vata are dry, light, cold, rough, subtle, and mobile. So extreme dryness or cold temperature can create more pain or exacerbate this pain, as well as roughness, which would be exercise and movement. The mobile quality of vata can cause the pain to radiate, and it can move from one place in the body to another. Many times vata pain is seemingly causeless. The pain is mobile, radiating, fluctuating, and often vague in nature. Vata pain is aggravated at vata times of the day, which are dawn, and dusk, and there's more intense pain during the Vata seasons like fall and winter. And like I said, it's aggravated by cold and also aggravated by poor food combining, excessive movement, excessive exercise, and often it's accompanied by flatulence, constipation, and bloating. So if we use arthritic pain as an example, if we had a Vata joint pain, then it would hurt with movement. There would feel some grinding or snapping or cracking in the joints, and this would exasperate the pain, and it would feel better when it was a warm, like a hot pad, or warming herbs, or ginger poultice or paste. Hot bath, salt bath would be warm and wet, and this would help to relieve Vata type of pain. And cold weather would make it, and cooling herbs could make it worse. So it's very important to see if you have that type of pain. This, of course, is more common with a Vata type of person who's thin, dry, and has the same qualities of, and usually underweight, low body fat, and there's not much fat on the body, and thus less cartilage between the joints, and thus we get this type of grinding type of pain that hurts with movement. So the next type is Pitta type, and we know that Pitta is generally hot, sharp, spreading, and oily, liquid, and light by nature. And when these qualities are increased, and Pitta is then blocking the Vata, then Pitta attributes mix with Vata and create a Pitta type of pain. Here we see an increased qualities of heat, burning, inflammation, and the sharp qualities can create ulceration and even perforation, particularly in the GI tract. Increased oily quality may increase the congestion and produce nausea, and the spreading quality of Pitta may cause the pain to flare up and creating tenderness and pain on pressure. Pitta pain is associated with inflammation and increases during the midday, midnight, and during the summer seasons when it's warm. It is often followed by nausea and even vomiting and diarrhea. It is increased by exposure to heat and pacified by cooling treatments. Note that while heating treatments relieve Vata pain and increases Pitta pain, both Vata and Pitta pain are worsened by movement and activity. Therefore, fast walking and vigorous exercise can aggravate arthritic pain that is caused by Vata or Pitta. So, using the same example of arthritic joint pain, if it was Pitta pain, we would feel the heat, we'd feel the inflammation, even on the joints, we'd feel heat. Whether it's the lower back, we'd feel the heat in the lower back, on the spinal column. We could feel the inflammation. So it's really main quality is we can feel the heat and inflammation. So this type of person, if they put a hot pad on it, heating pad on it, it's going to feel worse. And if they're using heating herbs or putting ginger paste on it or cayenne to relieve the pain, it's only going to feel worse. So it's going to do much better with cooling substances, an anti-inflammatory diet, and topical substances like aloe vera, which we know are very cooling, or coconut oil, which is also cooling in its nature. So very important to understand if you have a Pitta pain. It's very common because it's inflammatory. Now the third type is Kapha pain, and we know that Kapha is heavy, dull, slow, oily, sticky, static, and liquid. And when these qualities of the Kapha are disturbed and block Vata, the resulting pain will have Kapha type characteristics. Because of the heavy qualities of Kapha type pain, the pain will be deep in the joints. Kapha is slow and dull, hence Kapha pain is a dull type of ache. It is also liquid and cool, so the skin is often affected to the areas, and the person feels cold and clammy. Due to both the liquid and oily qualities, Kapha pain is associated with congestion, swelling, edema, and because Kapha is static, the pain is localized, neither radiating like Vata or spreading like Pitta. Pressure and deep massage can relieve Kapha pain. So do movements, exercise, and warming exercises and movements will help improvement. Kapha pain occurs more in the early morning and the early evening, which are the kapha times of day, and the winter and spring seasons. Now, if we use the same example, if on arthritic pain, if it was kapha, we'd see swelling. Particularly, we see it in the ankles, the knees, where they're swollen and they hurt, and by the person walking, they feel relieved. By taking diuretic herbs to reduce the swelling, the pain can be reduced. But also often it's a matter of detoxing and decongesting and reducing down the kapha to reduce the pain. So taking just analgesic or pain reducing herbs, or pain medicine for that matter, isn't addressing the cause in all three of these doshic imbalances. You have to address them at the cause, and in the case of kapha, it's the excess kapha. So the diet would have to be supportive. In other words, we want to reduce kapha by reducing the kapha provoking foods, dairy, fatty foods, oily foods, fried foods, heavy foods, oily foods. And for pitta, we'd want to reduce pitta increasing foods like pitta or inflammatory increasing foods like peppers, gingers, garlic, and nightshades, tomatoes, peppers, potatoes, and acidic foods, sour fruits. These would all need to be reduced to reduce down the pitta, and then the pain is reduced because you're addressing the cause. Of course, for the vata, it's a matter of improving the digestion, reducing down the vata, and there dairy, butter in particular could help, because the vata has a lack of fat, a lack of cartilage between the joints. So by having more dairy and more fatty foods can actually help vata type of joint pain. So it's very important to understand your type of joint pain before you determine your diet, and it's very important to understand your type of joint pain before you start a treatment protocol, or even which herbs and herbal formulas that you're going to take. I'll do a subsequent video about the treatments, the diets, and the recommended herbs for each of these three types. But I hope that helps you classify your pain and have a better understanding of it. Thank you very much.